Good morning again. Your lucky day, you get to see me twice, and I'm thrilled to be back to talk a little bit more about our healthcare solutions. Different by design is a theme that we started last year, talking about our data platforms. Don talked about different by design in our company, and I'd like to give you the landscape of our healthcare solutions. But I would like to start with a personal note. I grew up in rural Pennsylvania, not far from 3 Mile Island. I mentioned that before. And this is where accessing healthcare was often difficult. Getting care could often mean long drives, a few local options, and a great deal of effort just to move from one part of the system to the next. That experience shaped how I think about healthcare, because in rural communities, the challenge is not only whether the care is available, it's whether people can actually access it, whether the information follows them, whether care teams, often separated by distance and stretched resources, can work around the patient's needs. And when that doesn't happen, the consequences are not abstract. A missed follow-up can lead to a complication. A delayed referral can become a later diagnosis, and a medication change that doesn't reach the next clinician could become a safety risk. I live in Boston now, where access to care looks very different. But that contrast has only reinforced a lesson for me. When healthcare does not work as a connected system, communities are often where the cost is felt first and most deeply. And that's why coordination matters. Healthcare is hard, and it relies on the systems to work cohesively. And when that fails, what you see is clinical deterioration, preventable events on top of operational symptoms, delays, duplicate work. You could avoid ED visits and people getting lost, dropping out of the system that's designed to care for them. So how do we solve real problems like these? We solve them by delivering the ability to integrate and provide valuable, complete data across the ecosystem. So it's clean, usable, and AI ready. And then we make that data impact the real world solutions that solve real problems. We provide ways to build the workflows and applications that you can trust. We enable you to connect the systems and partners that you already rely on, and we offer solutions for you to buy when you need identity management, longitudinal records, population insight, and let it scale. So we talked earlier about interoperability and how interoperability really is that backbone, and it's the backbone to our different by design healthcare portfolio, which allows you to build, connect, or buy specific and discrete solutions. Last year, I'll talk about build first. Last year, you heard about our cornerstone partnership with Epic on this stage, and how Epic has built their EHR on InterSystems technology, and that requires trust in the breadth and depth of what we do. We also heard from Blue Cross Blue Shield Association how they have built a hub and spoke model for health plans. And it goes further, because when you build on a platform designed for healthcare data, you can create modern experiences that directly improves lives. Here in the US, there we go. Now I'll get there. Here in the US, Coordinisa, an innovative nurse-designed platform, fundamentally transforms field care delivery, uses InterSystems to reduce application development costs and complexity by 95%. In the UK, eConsult uses our technology to support patients getting help and advice for free from anywhere through NHS digital triage. And in Australia, Southwest Alliance of Rural Health and Barwon Health use Iris to make healthcare data available in real time for AI, machine learning, business intelligence, clinical intelligence, and building AI-ready data foundation specifically for rural healthcare. So that's build. That's the build part of our portfolio, creating solutions and workflows that expand without having to rebuild the plumbing every time. And whatever the systems are, and whether they're built on top of our technology or others, they definitely need to talk to each other. And this is where Connect is so important. This is where interoperability as a backbone becomes real, because siloed systems don't meet care needs. Point solutions fail. According to a recent Chime survey, 60% of healthcare IT leaders oversee between 250 and 1,000 applications, and some actually support up to 3,000 applications across their enterprise. And that's why integration is not optional. It's the central nervous system that makes everything around it work. In fact, 2/3 of the world's best hospitals use our products. And it's not just providers. Many of our HIE customers are already doing this at a regional, state, or national scale, building the connective tissue across competing organizations so that that can move with the patient. In rural healthcare, the need goes even further to helping communities, regional partners, care networks function more cohesively across distance, resource constraints, and uneven access. And that's why today, I'm so happy that we're announcing the InterSystems Regional Health Connections, designed to meet the needs of rural healthcare. InterSystems Regional Health Connections is built for the reality of rural transformation, and it has to happen across the region, not just inside of one organization. It helps rural providers, health systems, community partners, public sector stakeholders make a more coordinated foundation. And when regions are better connected to care, they can stay local more often. Specialist expertise can reach farther, transitions can improve, and data becomes more complete, current, and useful. And this is interoperability that is the backbone of, in practice, coordinated infrastructure that helps rural healthcare become more accessible, sustainable, and effective. And our entire portfolio is really optimized around pulling these things together to create care with the patient at the center. One of our HIE customers, HealthX, does this at phenomenal scale already. Each month, more than 1.2 million records are viewed. It's a reliable source. In fact, each year, they receive more than 1 trillion inbound message, which speaks to their scale. The holy grail for all of us is clean, usable clinical data. AI that works requires more than data. It requires data that is trustworthy and ready, complete, correct, current, and contextual. And we continue to build out tooling and capabilities for data provisioning and transformation so that organizations can move from connected data to usable data faster. And finally, when you need a use case specific solution, then we have things that you can buy. This is where you and organizations like you leverage solutions on top of the foundation that we've been discussing this morning for clean data and system-wide coordination. The capabilities that meet specific use case needs, solving real problems like a longitudinal record that's usable in workflows, notification services, cohorts and population views, and prior authorization. East Tennessee Health Information Network leverages HealthShare Unified Care Record to help healthcare organizations improve the continuity of care and patient outcomes by providing fast, reliable, and secure access to over 1.5 billion clinical records. Today, this nonprofit connects over 500 locations across Tennessee, serving more than 120 participants ranging from hospital systems and healthcare plans to EMS agencies, coroners, and rural pharmacies. When you need a comprehensive way to manage identification like Health Connect Texas, InterSystems Enterprise Master Patient Index solves it seamlessly. They have currently 23 million distinct MPIDs being managed in our system. And in our global EHR business, IntelliCare, our users at EMC Indonesia are seeing fantastic results across their 8 hospitals with AI, automating about 52% of routine documentation tasks, and AI-assisted information retrieval decreasing from over 7 minutes to 1 to 2 minutes. So let's put it all together. This isn't just a set of products, it's a cohesive portfolio designed to work together to meet real healthcare needs. Organizations can start wherever they are and still end up with a cohesive system, built on InterSystems Iris for Health, InterSystems Data Studio to create workflows and data products that differentiate them, Connect with Health Connect and InterSystems Payer Connector to link clinical and administrative ecosystems end to end. Extend that model regionally with InterSystems Regional Health Connections, which is designed to support more coordinated rural care ecosystems. And buy with HealthShare Unified Care Record, EMPI, provider directory, health insight, and more, to standardize the shared foundations that make it scalable and measurable. Together, it's interoperability as a backbone for producing clean, usable clinical data so we can deliver AI that works and solve key solutions with fully built products. And while the expression problem, there we go. And while the expression of the problem varies by market, the underlying need is remarkably consistent. In providers, it's about turning fragmented patient information, something clinicians and care teams can actually use at the moment when care is delivered. In health plans, it's about reducing administrative friction and connecting clinical and operational signals early enough to improve experience, costs, and outcomes for members. In HIEs, it's about becoming trusted connective tissue across a community, making the record more complete, more current, and more useful wherever care happens. In communities, it's about making the distance less dangerous so that care coordination, specialist input, and follow-through do not depend on geography. And increasingly in rural America, that means thinking regionally, creating the shared connections that help local care remain viable while making the broader system work more cohesively around the patient. In government, it's about seeing the full population clearly, enough to respond, report, coordinate, and build healthy citizens. And in MedTech, turning device and diagnostic data into timely, actionable insights so clinicians, care teams, and patients can make better decisions with less friction. Different segments, different pressure points, but one common requirement: interoperability as the backbone, so data becomes useful, actionable, and ready to support better decisions. So I'll end here where I started, in rural Pennsylvania, the family farm. And the challenge is not theoretical, it's personal. It is a reality of distance, delayed access, stretched resources, and often a system that asks patients and families to do the work of holding care together. And that is why the real challenge in healthcare is not just collecting data, not just connecting systems, but it's making sure that the knowledge moves fast enough, clearly enough, and reliably enough to change what happens next. Because at the end of the day, the goal is simple: to make care real everywhere.